Good afternoon. Welcome to today's Wisconsin Health News virtual panel on what's next for food as medicine. My name is Tim Stum. I'm the editor of Wisconsin Health News. Thanks to all of you for tuning in. We have a really great panel with us today to talk about this exciting topic. I'm thrilled to introduce Kathy Koshgarian, CEO of Food for Health, Rachel Roller, CEO of the Dohmen Company Foundation, Amanda Dreyer, Medicaid Director for the state of Wisconsin, and Michelle Ford, Director of Health System Partnerships for Feeding America Eastern Wisconsin. Thank you all for doing this. Before we get started, I want to make sure we thank our generous sponsors of the Wisconsin Health News virtual series. Healthcare leaders from across the state sign up to watch these virtual events, and they would not be possible without the generous support of our sponsors. So a huge thank you to Aurora Healthcare, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Delta Dental of Wisconsin, Amplify Health, Marshfield Clinic, Gainwell, and RSM. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like this, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial, which you can do on our website at wisconsinhealthnews.com. And I want to give an extra thanks today to Gainwell, today's featured sponsor. We are really grateful for their generous support. Here to say some words is Stacy Riley from Gainwell.
Good afternoon, and thank you to Wisconsin Health News for bringing together leaders who are shaping the future of healthcare in our state. I'm Stacy Riley, the Account General Manager for Gainwell Technologies in Wisconsin. Medicaid plays a vital role in the health and well-being of our state, supporting hundreds of thousands of Wisconsin residents and serving as a critical foundation for providers, communities, and families. Wisconsin has long been recognized as a leader in how it administers and evolves its Medicaid program, consistently demonstrating a commitment to innovation, strong partnerships, and a focus on delivering high-quality care to those who need it most. At Gainwell, we are proud to be a part of that mission. As the state's Medicaid fiscal agent and MMIS partner, we help ensure the program runs with precision and reliability, supporting members and providers, ensuring claims are processed accurately, strengthening program integrity, and enabling better outcomes through data and technology. While we serve 34 states nationwide, Wisconsin stands out for its collaboration, its foresight, and its focus on doing what is right for members and providers. We are also at a pivotal moment for Medicaid. The pace of change driven by federal priorities and the evolving needs of communities is accelerating. What inspires us is how Wisconsin continues to meet that moment with clarity, with empathy, and with a willingness to lead. Gainwell's honored to partner with the state in this work and to contribute to a program that truly makes a difference in people's lives. Thank you again for the opportunity to be here today. I look forward to these conversations.
Well, thank you, Stacy. And thanks again to Gainwell for the generous support. Thanks again to our panelists for being here. In his nearly 1.5-year tenure at the helm of the Department of Health and Human Services, Secretary Robert F. Kennedy Jr. has shone a spotlight on food. He sees it as a primary tool for treating chronic disease and has targeted ultra-processed foods, reformed the federal dietary guidelines, and pushed nutrition education in medical schools. But what has it meant for the burgeoning food is medicine movement? Is the newish administration progressing policy to increase nutrition's reach in healthcare? Are more providers embracing the movement? And what do payers think? Meanwhile, the state last year launched a food as medicine benefit for certain Medicaid members. How has that gone so far? And what impact has it had on health outcomes? We're hoping to tackle these questions and more. And we've assembled an expert crew of food as medicine leaders to help us out. So let's dive in. And Kathy, let's start with you. What was the current state of the food as medicine movement? How has the landscape changed in recent years? And how does your organization, Food for Health, fit into these efforts?
Well, thank you, Tim, and I'm happy to kick off the conversation. So thank you very much. I got to tell you, we started on this journey in the food as medicine space nearly 6 years ago, almost to the date. And over the course of the past 6 years, if I look back 6 years ago, having the conversation relative to eliminating diet-related disease and truly normalizing and democratizing the concept of food as medicine and medically tailored meals, it was kind of met with a big question mark because it wasn't part of the lexicon. It wasn't a conventional consideration as the most efficacious intervention to essentially provide nutritional security, but then also to prevent, manage, and reverse chronic diet-related disease. And just merely, fast forward 6 years, and that was in the face of the pandemic in 2020. We don't want to go back to that, right, or recall that. There's been some significant advancements. This is case in point, the conversation we're having here today. The movement truly is in full force. There's significant support, but then also, data and proof of the efficacy of food as medicine being one of the highest efficacious and buoyed interventions relative to nutritional security, but then also to prevent, manage, and reverse diet related disease. And I have to say, just here in the state of Wisconsin, big kudos, and how proud should we be, to Stacy's point, of really putting Wisconsin on the map with regards to being somewhat pioneers in the space as well too, with the deployment of the first food as medicine Medicaid benefit with medically tailored meals about a year and a half ago, but then also with the support and the application for an officer in the food as medicine space to truly, take our opportunity in this moonshot moment to the next level. And so, from a macro perspective, huge evolution that I've seen in the past 6 years, and significant tailwinds over the course of the past 2 years or so. And as a practitioner, of the president and CEO of Food for Health and the Food Benefit Company, that has meant significant growth. It has meant scale. It has meant broader collaborations, both at the national and local level, which has brought together an ecosystem of like-minded organizations that truly are bringing the intersection of food and healthcare together for those individuals that are most in need of a food as medicine solution. And so for our organization to be the tip of the spear 6 years ago here in the state of Wisconsin as a practitioner to where we're at today, to see a full ecosystem emerging is extremely exciting.
Thank you, Kathy. Michelle, what would you add to that? Why is food as medicine important? Why are we talking about this? Why are all these great organizations so involved in these efforts?
Great, Tim. So, as you know, much of my background before coming to the bank has been doing some consulting work across the country to working with the health ecosystem to address health-related social needs. And so I've been working with organizations across different markets across the country, identifying ways that we can solve for addressing these social needs and building models of care to support addressing those needs, right? And so food, of course, is one of them. And we are recognizing that, as we build these models, right, there's some need to have some collaboration across support systems. So while we are addressing food, making sure that we have a process of identifying other needs that can also be supported. And so the great thing about what's happening, as we look at addressing, food insecurity and chronic condition, that the models we build can also play a great role in partnering across systems to make sure that we're protecting and supporting the full well-being of people.
Thank you, Michelle. That's a really good point. Around food as medicine, well, what specifically is happening at Feeding America? What are you doing and working on now around food as medicine?
Sure. Well, I've been at Feeding America now for about a year, a little bit over a few months. And it's really exciting times because at the national level, our Feeding America National has engaged many of us across the network on a task force to build a model that will provide some sustainability across markets for this work. And so what we're doing is building a system of care and revenue model that can be piloted in markets in partnership with a national MCL that's invested in this work. And so there are some banks who are have started down this path. There are some who are further along than others. We are assessing the state of readiness for those organizations who have the capacity and willingness to do this work. But the exciting thing is that we have many that are doing it. We have ecosystem partners are ready to invest in it. And so looking forward to starting to map out, not just map out, but start identifying those markets that we're going to be doing this work in across the state, probably not in the state, but probably by early January, we're going to be laying this out across markets across the country, which is really exciting.
Excellent. And is this happening in Wisconsin, or is this something that is being talked about in Wisconsin? Kind of what's the status of that in Wisconsin?
Yeah. So Wisconsin is going to be one of those markets. We have that MCL partner has identified the core markets that they want to do this pilot testing in, and Wisconsin is definitely one of them.
Great. And you work with a lot of health systems in the state. You're the director of health system partnerships at Feeding America in Eastern Wisconsin. How are they currently approaching food as medicine, and how has that changed in recent years, or maybe not changed?
I will say that there is clearly interest from all the health system partners. I've talked to FQHCs, MCOs, I've talked to hospital systems, even the free clinics and other clinics across the state. And there clearly has been identified a need through many of the community health plans and those community health assessments that, the access to food, addressing food insecurity, addressing chronic conditions is a huge priority for everyone. And what I'm seeing is that everyone's approaching it very differently. Some might, not many are in the space yet of wanting to contract, and then you have those who are supporting the work through grants and other partnerships, but they are all doing them in very different ways. And so I know recently, at the end of last year, I met with the Milwaukee Health Care Partnership, who all said, we know that this work is important. I think that the challenge is identifying, what's the thing, right, that people want to commit to together and follow a path together. And I think right now people are just kind of figuring out, what to do, how to do it, and when to do it.
Mm-hmm. Great. Thank you. Amanda, can you briefly talk about how the state Medicaid program is approaching food as medicine? I want to get into kind of more of the specifics of this offering a little later in the program. But for now, can you just talk about, what this is, why this is something the program moved forward with, and who is eligible for this right now?
Sure. So as mentioned early on, the state Medicaid program launched a new in lieu of services medically tailored meal benefit. And I think a lot of the conversation that we're having today already highlights there's so many ways. Like you said, Michelle, we got to pick a path together and decide where we want to put our effort. But there are so many ways we can come at the conversation and the support that people need when we talk about food being a part of your medical journey, preventative or curative. The state's first vehicle is really this in lieu of service for medically tailored meals. And what that means is our managed care partners, our health plans who offer a Medicaid plan. There are 13 of them today. They get to choose to offer a food benefit for a population of individuals in lieu of or instead of another benefit. And the idea here being it is hopefully more effective, particularly in the long term, to help individuals at a particular moment in their medical needs to learn some new skills, to have some food support, probably when you could use an extra set of hands at home, um, begin to manage that chronic disease differently. Today, we are really thinking about treatment, and tomorrow, we're really hoping to begin to think about prevention. The individuals who today may be eligible, it depends on your plan, but the three populations of individuals we're really focused on today are one, individuals who have recently been hospitalized and have a primary condition or a secondary condition. A major reason for their health needs is either diabetes or cardiovascular disease. And then the other group of individuals that we're focused on are those folks who are pregnant or recently ended a pregnancy and have high risk. So maybe an example for them is they maybe also have a cardiovascular illness or preeclampsia or gestational diabetes. And so if you are any of these individuals and your health plan is offering a medically tailored meal service, that means for 12 weeks, you get a diet specified meal plan. It doesn't provide all of your meals for the day, but it does provide 2 meals for a day. It's ready to go. You warm it up. It's specifically tailored for your dietary needs. And then also a key part of this is working with a registered dietitian, a professional who can help you understand what's the illness you're working through, why and how does food, your diet, help you or hurt you on that journey? What are some things you need to be thinking about, and how do we help you build some new skills? So definitely like you're saying too, Michelle, a whole system approach, a model of care for how can we establish this as a benefit, begin to get some information about how are we making healthcare more affordable for folks, and also how are we beginning to prevent illness? Where can we put more time and effort into making an impactful benefit for everyone, including folks who have Medicaid?
And so the state, as Kathy mentioned, the state also applied for funding this spring for a dedicated officer for food as medicine. Can you talk a little bit more about that? What's the status of this application, and what impact, if the state does receive that funding, what impact would that have on food as medicine? Would the program be able to expand offerings? Kind of what would happen next if the state gets this?
This could be super exciting for us. So, like anyone who applies for a grant, you don't want to get too excited before it arrives. And so fingers crossed. And, in the event that this does not happen for us, hopefully on the off chance that this does not happen for Wisconsin, we will find a way. We're really thinking about, one, how do we scale what food as medicine could be for Wisconsin for the long term? But two, being a single state agency that includes both Medicaid and public health, there are so many ways that we could collaborate and partner and create a system that supports effective innovations. I think a food as medicine officer would be incredibly impactful for Wisconsin in pulling together all of those potential interventions, creating and establishing and working toward a bold vision that makes sense for Wisconsin. And to do that fairly immediately. So we will hopefully find out here in the next, handful of days if Wisconsin is on that short list. And then, the work lies ahead. So would love to be able to pass this to the food as medicine officer to give us a big, bold vision and some dedicated attention to making it the magic really happen in real life. So stay tuned. We will all find out together.
Great, thank you. Rachel, you've done a lot of work on food as medicine on the national front. Can you talk a little bit about that? I mean, is this taking hold nationally? What's happening at the national landscape, and how has that changed in recent years?
Well, I first just want to start by thanking you, Tim, and Wisconsin Health News for continuing to prioritize this issue. It's such an important one. It affects every community across the nation. Diet-related disease is in nearly every family. I imagine that many of us have a loved one who is struggling with diabetes, cardiovascular disease, and possibly high blood pressure. And all of those are consequences, unfortunately, from a traditional food system that is prioritizing profit over health. And so at the Dohmen Company Foundation, we are very focused on, at a national level, on elevating a national conversation about the importance of making our food system in America healthy and promoting health and wellness. And so food as medicine is critical to that theory of change. It's a necessity, with nearly 50% of Americans across the nation struggling with one or more diet-related disease. This is one of the largest epidemics that our country has ever faced in its entire history. And so it's encouraging to see the momentum of the movement at a national level, and as well as at the state level. To hear all the responses from my panelists today is very encouraging. I'll share, it's been exciting to see the expansion of food as medicine to focus not only on addressing and managing chronic disease, but also preventing it in the first place. You mentioned the dietary guidelines coming out. I mean, the new dietary guidelines are promoting whole foods and limiting or avoiding highly processed foods, which is unprecedented for our country. Even recognizing that is a big step forward. Limiting foods and drinks that have artificial flavors and colors and preservatives is really important, again, to addressing a more healthful food supply for our country. And so I'm really encouraged by the progress that's being made within the food as medicine movement. Unfortunately, there are some limitations from a regulatory standpoint that are limiting the administration from being able to cover food as a benefit category. That's something that's defined by Congress. So with new payment models like Elevate and Access and all these really exciting models that are coming out that are allowing for more flexibility to cover non-traditional healthcare expenses. Unfortunately, food currently isn't in that paradigm. And I'm hopeful that with a continued emphasis and coalition building amongst the food as medicine movement, that we'll get there. There is a really exciting convening next week that we helped sponsored called FemCon, where 800 of the leading food as medicine practitioners, providers, payer community, and policymakers are all coming together under one roof. And they're going to talk through the science, the efficacy that Kathy referred to earlier, the impact that food as medicine interventions are having at a state-based level. It's just so exciting to see the innovation that's occurring within state Medicaid programs right now. They really are the leader in addressing this critical need, especially for underserved populations. So I am very encouraged, but we still have a lot of work to do.
Thank you, Rachel. So as we hear about what's happening in Wisconsin, and you've worked with other states and looked at what other states are doing, how does Wisconsin compare to what's happening around the country in terms of how the food as medicine movement is going?
Well, of course, I'm biased because I'm from Wisconsin. So I'm really encouraged to see Wisconsin join. I think it's about 30 states now that are innovating with providing flexibilities, whether it's through the in lieu of service opportunity, as well as submitting waivers. And so it's so encouraging to see Wisconsin part of this amazing patch quilt of state innovations that are coming forward. And to see the progress being made in Wisconsin is just very encouraging. There are some states that have been, really leading the way for quite some time now, and I think I should be calling out California and New York in particular, that have paved the way for other states to think very boldly about how they're addressing social determinants of health and food and nutrition being paramount. So I
And
hope.
what, just like briefly, are they doing that's a little different than some of the other states?
Well, their eligibility criteria is a bit broader. The level of reimbursement and the services extend beyond the medically tailored meal definition. So you have things like medically tailored groceries and produce prescriptions that are also allowable services. and then additional nutrition support services, because as we all know, education is so critical to sustaining and building health improvement within populations. We really need to empower patients to make the right healthy choices. And oftentimes that requires, additional services beyond what's currently covered under Medicaid. So many states are taking those steps, but I do want to recognize Wisconsin for taking a very important first step, and hope that they continue to look to broaden. And I'm encouraged by Amanda's comment about thinking about that through the state officer program.
And you, Rachel, you've met and worked with members of the Trump administration. Could you talk about how they so far have approached healthy foods and their impact on health outcomes, and how this work aligns with some of the work you're actually doing at the Dohmen Company Foundation?
Well, like I mentioned earlier, the federal administration is really focused primarily on food quality and safety right now. So you have the new dietary guidelines that have come out. You also have, looking at the Food and Drug Administration, there's a strong signal toward reforming the regulatory environment around food. So there was a recent request for information on defining ultra processed food. We currently don't have one designated definition around that category. And again, that category is the root cause of many of the diet-related diseases that are proliferating across the United States. And with 60% of the American adult diet and 70% of our US children's diet reliant on ultra processed food, this is a huge problem. So I'm very encouraged to see the administration signaling to take action in defining this category of food, as well as narrowing the GRAS loophole, which is the generally recognized as safe loophole that is allowed for many harmful ingredients to be in our food supply, while other countries around the world are limiting access and prohibiting the use of many of these harmful chemicals. And then, of course, as I mentioned earlier, I think, providing consumers with knowledge and information about making healthy choices is so critical. And, the focus of the administration right now on front package labeling, I think is a really important step. We've done some public polling ourselves, and it's just incredible to see how the public understands that this is a problem. And they really are looking for solutions to make choices for themselves and their families. And so I'm very encouraged by the efforts of the administration around really making sure that the information is transparent and it's provided in a way that people can really empower themselves to make the right choice.
Thank you. Kathy, the current federal administration has certainly highlighted healthy food and its importance on health outcomes. What do you think this has meant for the food as medicine movement? Are they moving it forward? Why or why not?
So absolutely. And the outcomes that have been published at a national aggregate level prove the efficacy, right, and the positive outcomes of food as medicine as an intervention, and specifically buoying up medically tailored meals as one of the most precise food as medicine solutions in the basket array of food as medicine options and solutions has been extremely helpful. And so the administration's focus on nutrition expansion and nutrition expansion in multiple categories that also support the normalization and the focus on implementation of nutritional standards what constitutes safety standards, what also constitutes essentially the underpinnings of the systemic change that's needed to truly reverse the decades of issues that have arisen because of our food system and ultra processed foods has it's really started, and we are seeing that from the federal level, starting at baseline with the opportunity to expand and to grow, and it's extremely exciting to start to see many of these areas of priority come to light. And so these areas of priority can manifest in multiple different ways, but seeing the expansion of nutrition as a priority is really effectuating in a number of the examples that have been given by my other panelist colleagues. But then what's to also come, either towards the end of this year and going into next year, with the work of bringing standardization and standard criteria with regards to what truly defines a food as medicine solution, with regards to not just having the standardization, but credentializing food as medicine solutions and nutritional standards at multiple levels, to then also take a more macro approach, starting with CMS. So the nutritional guidelines is a starting point. That is an example, is a here's what, and really good movement and progress in changing the system. It then now needs to manifest into a so what. And that so what is starting to emerge relative to the focus on standardization, efficacy, normalization, and then last but not least, data. Because data drives decisions. And the data driving decisions will also then assist with participation. So participation with health plans, with health systems, but then also individuals themselves as well too. And so, with that, it's important to be able to provide access, especially to our underserved individuals and communities, to the basic human right of fresh, healthy food, but then to also help to maintain that, right? Because we're doing good, right, by being able to get the access to 12 to 14 weeks of programming, but that then creates basically could create a gap or a cliff, to Rachel's point earlier. So if it's a post-discharge scenario, we're starting to create those healthy behaviors, but then what's the so what to continue to maintain that? And that's where a multi-dimensional intervention is extremely important as it relates to food as medicine, with providing access and a standardized solution and intervention with regards to education, and then the opportunity for continued maintenance. And so from the federal level, the regulatory level, and seeing the winds of change and how that's effectuating from baseline and then starting to amplify is extremely important. But at the same time, too, how to break that then down to how do we ensure that we are being very clear and precise with our execution here in Wisconsin. We have to start somewhere, and then learn from that starting point, and then expand our offerings and access in the food as medicine space to continue to show essentially that progress and that efficacy.
Thank you. Michelle, I know that you, like Rachel, have been involved in some of these efforts around standardization, which is, I think, a key thing, something that keeps coming up when you talk to people about food as medicine, the importance of getting this kind of national standardization. Can you just talk a little bit about, the work that you're involved around that, and why that is important to have more of the standardization?
When you think about, for example, food banks, being supportive in this space, and this being new, I'm imagining food banks entering into the realm of health care and health care delivery, that we want to make sure that the work that we're doing has some standards where we can start from somewhere. So the reality is, all markets are different, but we still need some place for everyone to start in a consistent way. And when I think about, a lot of the research that's been done, I've worked with the Camden Coalition on projects where they've worked with the ecosystem to define standards, worked with the Center for Healthcare Strategies, where they have helped work with community-based organizations and others to build standards. And then what I'm seeing is that that what's coming up, what's brewing, are the same consistent things around quality, around nutritional standards, around how we make sure that food is safe and secure, which is a good thing. So we're seeing that, what's bubbling up in terms of standards are really consistent across these kinds of opportunities that are happening in these projects. I will also say that, I've enjoyed spending some time with states where I've helped build applications for 1115 waivers, have applied for state waivers in certain situations, and recognizing that in this new world, that those waivers, while some exist, there's not as much push for those moving forward. So those 1115 waivers have offered clear ways, pathways for innovation to occur. And so when you think about the work that's happening, lots of that innovation has happened as a result of partnerships happening in systems and markets that have allowed that ecosystem to come together and work together collectively for to address food as medicine or other social needs. So I really feel like there's lots of research and evidence that's out here. It's just a matter of us identifying what works for Wisconsin, right? Building a strategy to work together, because that's the key. Sometimes it's often missed that, convening the people with some shared vision and mission to move forward is going to be important for us to move the work ahead.
Thank you. Amanda, coming back to you, can you talk more about how Wisconsin's effort around this with Medicaid has gone so far? So this has been, I think, a little over a year since the Medicaid program has been offering this benefit. How has it gone so far? What is the uptake in terms of the HMOs and enrollees around this?
Yeah. That's exactly what you're saying, Kathy, right? The data drives decisions. It helps spark more excitement, and helps us grow and scale for sure. An interesting thing about medicine is that data can come slowly. So, for example, medical billing is a thing. It's a thing to learn. It's a thing. So as we talk about having health plans, folks like Medicaid, insurance companies begin to enter the food space using food as a medical intervention, it also means we are stepping into the medical processes, and that's an experience. So all of that to say, the data is still coming in. A few things that we know already. One, you can begin to measure success simply by the attention and excitement that is happening. I think today is a good example of that. I think to point at the innovations and the incredible partners we have in the field, like Feeding Wisconsin, like Food is Health. There is more and more excitement building, more and more models, more and more innovation happening that helps us move this forward. That also helps with patient awareness that this is a thing that could be available to them. And when like you said, Rachel, when patients know, when we are empowering populations, people with information, then they can advocate for their own needs and ask for the resources they need. The standards you all are talking about help us assure that when someone shows up at the grocery store, which is hopefully nearby and open and offering the healthy foods you need. Maybe you're using your SNAP card to make those purchases. You can feel confident that the food on that shelf is going to help you with a healthy diet, help your family with a healthy diet, and will be affordable, something that you can actually buy today. So excitement and engagement is a primary key right now in the data that we have. To that end, we have seen most of our health plans begin to stand up some kind of medically tailored meal option in lieu of service option. That's still growing. That doesn't mean every plan, not all 13 plans are offering that today. And we, of course, as always, the details are where that can make or break in the system. And so part of our goal and part of what we'll work on in the future is how to make that medical experience, medical billing, the work to operationalize an in lieu of service or however Medicaid can help step into the food as medicine space. How do we make that a clear standard process that folks know how it works? They can build a system to it, and the process just flows to enable good work that's happening already. So we'll certainly learn more about, are we, for example, making healthcare less expensive? Are we avoiding really expensive readmissions into the hospital? Are we helping make people healthier? Are their A1Cs for their diabetes coming down? Is their blood pressure coming down as part of this intervention? Those are questions we don't yet know, but will be part of our study.
And how much are these standards? Should these be happening, do you think, at the federal level or the state level, or who should be, in charge of developing these standards?
Yeah, that's an excellent question. And it's always the balance of innovation and the secure foundation that that innovation needs to rely on. There are many things that do happen, can happen, need to happen at the federal level. I think, the example raised about FDA approvals, about nutritional standards, those are realities we all have relied on the federal government for, and, all broadly have agreed that that is the right place. So you can go state to state and what is safe is safe. You're getting what you're getting. It's transparent, it's clear. It's, the same in Wisconsin as it is in any other state. And then there's a variety of things that need to happen locally. Michelle, you mentioned that really specifically. Like each market is different, and Wisconsin has a lot of good strengths, and we got our own needs that are unique. To that end, there are things then that Wisconsin can and should do, designing our own. Someday, if this is a thing that the federal government does begin to allow for again more broadly, it would be really cool for Wisconsin Medicaid to have a health-related social needs waiver that provides more access to food as medicine interventions above and beyond the vehicle we have available today. That would be awesome. And we would love to do that and design a New York style, a California-like approach that really embraces some of the innovation and cool things we know is true to Wisconsin. Our farmers are incredible. We've got access to healthy foods that other states don't necessarily always have. We've got cool things like the tribal elder food boxes that are happening. There's just so many places we could go that we'd love to see happen, and we need that collaboration with the federal government for the state government to be able to provide that kind of new standard, new way of operating that enables our own cool things in Wisconsin.
And you said for now, as of now, most of the HMOs in the program are offering this food as medicine. Like how many are offering it now?
I think about half in some form or
Okay.
fashion are offering out an in lieu of service with a medically tailored meal option. It's certainly
So like
growing,
7 of them are doing it?
I'm sorry, say
Like
that again.
about like 7 of them are offering.
I think that that's true. Yeah, about half.
Yeah.
And we see that continuing to grow. And a positive is that our teams continue to have conversations with each of those plans about what would this look like? What are you thinking? What do you need? And we've got operational things to do to help make that better, faster, easier. And we will do those things. Again, will be really nice if we can get a food as medicine officer to help us drive that and move a little faster, but we'll do it anyway. That's work on the work plan. That's happening.
Thanks.
Kathy,
Your organization.
could I
Yeah.
just interject for a second on
Yeah.
the point about standardization? Because
Yeah.
there are two resources that I just wanted to call out quickly.
Yeah.
that we were involved in funding. One is called Coding for Food, which was a collaborative effort led by the Gravity Project in Fulwell that defines billing codes that, once they're codified, could ultimately be provided as guidance to states and as well as the Medicare program. And so these would be billing codes that would reimburse for food-based interventions through Medicaid and Medicare. And then we would then have standardized billing data to better evaluate the health improvement impact and ROI to state Medicaid programs and Medicare. So those applications were completed through a very robust, immersive process and are now going to be submitted to CMS through the HCPC coding process in June. And then the second thing I wanted to mention is a medically tailored sustainability blueprint that was developed in partnership with the Food is Medicine Coalition and Harvard Center for Health Law and Policy Innovation. And that, again, was very immersive and collaborative because if you think about food as medicine, there are just so many contributors to ensure that the success of the delivery of these programs, the prescribing of these programs, the reimbursement side. So we wanted to make sure it was a very inclusive panel of experts, including medical experts, actuarial experts, legal experts. And so this to me is a critical effort because it addresses gaps that currently exist, standardization of gaps in terms of service delivery, eligibility, documentation standards. It answers really critical legal questions around medical necessity. These are all questions that are essential in order to really stand up a benefit, a medically tailored benefit. And so that information, that report has recently been published and is accessible to the public through the Food is Medicine Coalition. And I believe has been shared widely with state Medicaid directors and other policymakers to really hopefully help answer some of those critical questions and also help standardize the deliveries so that we do have data, not only data at a state-based level, but data that can be evaluated among multiple states or even at a national level to prove the efficacy of these solutions.
Excellent. So Tim, can I add
Yeah.
on to that as well too?
Yeah.
So Rachel, thank you for bringing that up. I was going to also point out, and so with the coding project, the Food for Health, we had the pleasure of being part of the group that assisted with that project with regards to the HIC and the PIC codes. And I also want to share as well too that there's a National Food as Medicine Coalition, but then the Wisconsin Food as Medicine Coalition is also working on how now do we take this good information and what would make sense to bring forward as relates to that we have the here's what, but the so what, and how could that then essentially manifest potentially into our state policy, Medicaid contract, interactions and discussions with the HMOs and payers, because to Amanda's really good point, we're about 18 months into our in lieu of service, and yes, about half of our HMO partners have activated the program, and so we are supporting the majority of those payers with their programming. There's an important point that has been brought up a couple of times from Michelle, and I heard Director Dreyer also address this. There's the importance of the federal support and definition, but each state has a unique population and unique populations within the state as well too. And so if we look at some of our state specific results and outcomes, we are significantly overperforming much of the national outcomes data relative to impact with our current programming. And the path currently right now truly is medically tailored meals with the focus on expansion. And say, for example, the maternal and infant health program that Food for Health launched about 2 years ago. We're seeing a 94% healthy birth outcome rate. That's beating the national performance by almost 15 percentage points. We are seeing a reduction in readmission rates by 74%. We are seeing a reduction in emergency department visits by 100%, very specifically for type 2 diabetes, cardiovascular disease, and hypertension. And so it's just so very important to marry both the good work that's happening at the federal level, right, to assist with getting the standardization, but then also having freedom in the framework for each of the states and you can actually say the municipalities and the populations within the states to also work directly with our populations, because we know our populations and we want to be able to put forward the solutions that are best for our community members, for our payer partners, for our providers, and ultimately the full ecosystem. So I just wanted to make sure to underscore that.
Yeah, thank you. And just to follow up on that, Kathy, a little bit. So as you mentioned, you are the main medically tailored meal provider right now for the Medicaid program. As we're 18 months into this program, it sounds like about seven of the 14 HMOs are offering the benefit. Would you have expected more by this point? Or I mean, what do you think of kind of the uptake, both in HMOs, but also members, the amount of people using this benefit so far?
So it's a couple of things. Wisconsin, we 18 months ago launched our in lieu of service program and the benefit. There's been a number of states ahead of us, including California and New York, who've been mentioned previously, that actually were, they've launched their waivers and their programs, in some cases, closer to 10 years ago. And so we've had the benefit of being able to learn from others that have come before us. And what I'll share is that the learnings have also been incorporated because there were listening sessions and collaborative discussions between our Medicaid department and then also DHS with regards to informing the application and the design of our waiver. And with that, I'll say we're not alone, right, with regards to what we're experiencing. Other states as well too, because it's a learning experience, it's a new benefit. Though hopeful that when a new exciting benefit is launched, it's extremely innovative. We know it's impactful, it's needed. The hope would be a light switch enrollment, but in reality, if we look at other states, that isn't the case, and so there's still a bit of work to be done. The conversations with our Wisconsin HMOs and MCOs. MCO stands for Managed Care Organization. There was a question earlier with regards to what MCO means. Very proud of essentially the embracement, the discussion, and how to figure this out with a balanced approach. But I also want to share that we are basically experiencing similar uptake relative to the health plans deploying the benefit, and then also members / patients as other states. So as we're all very hopeful for that engagement and enrollment to increase, which it will, we have an opportunity to learn from other states that have come before us and incorporate some of those learnings as part of essentially the next evolution relative to the engagement on the uptake. And the biggest takeaway is we've got to understand if there's any confusion, which there's some confusion, and then be able to then put activities and tactics in place to mitigate that confusion.
What would you say, just briefly, Kathy, is overall the main barrier preventing further progress with food as medicine right now?
In the state or in
Overall, is it payment? Is it, is there kind of talking about awareness, education? What would you say is that? And I'll ask each of the panelists this as we kind of get close to this 1 o'clock cutoff time.
And so that's a great question. And it's a complex question because the answer is it's all of the above.
Mm-hmm.
It's all of the above. And food as medicine and the food as medicine pathway, it does require a roadmap. And along that road, there are multiple points and stops in that road for full adoption and uptake. And it ranges from education and first and foremost, standardization. Second, quality expectations. Third, then being able to create, the data to prove and show the impact of the intervention and the solution, creating awareness, and then being able to have the systems and infrastructure to support the benefit, which ranges from essentially, of course, we have the codes in place, but medical billing, data collection, and then reporting. And so it's a road and a roadmap as relates to increased adoption and normalization of the benefit.
Michelle, if you had to single out, one kind of main barrier, what would you say is the biggest barrier right now from preventing further progression of the food as medicine movement?
I think a couple of things to come to mind to me is, when I think of this, I think of it as a business solution, right? And so you've got in innovation, you need to move rapidly, but then we're dealing with public health and new things and culture. So there's some things that are at play that kind of compete against each other. The other thing I will say, in all honesty, and when I think about states who have worked through 1115, is that one thing we have to be mindful of in this space is the revenue model, and that the revenue model isn't fully committed to trying to focus on one level of revenue. That whatever the revenue model looks like, that it is a braided and blended one that engages beyond contracting, but other sources of income. And what does that revenue look like? And how do we have public and private partnerships in the revenue model that supports the blending over time for sustainability? Because you can start out using innovation, like a CMS innovation agreement for the next 3 to 4 years. Then when it's time to move on from that waiver, you're trying to figure out how to sustain. So from the beginning, as we are building these models, making sure that the revenue is diverse enough to, over time, that supports sustainability.
Rachel, how would you answer that question? What are the biggest barriers right now facing food as medicine?
I agree with Kathy and Michelle's comments. And so instead of focusing on the barriers, I'm just going to mention quickly a solution that's coming to Wisconsin that I'm very excited about. We're partnering with Rockefeller Foundation, Walmart Foundation, Builders Initiative, and the Food as Medicine Impact Fund to really address this awareness piece, which is absolutely critical. And so our hope through a state-based and national-based public awareness campaign around food as medicine is that we'll see awareness build, enrollment increase, and hopefully people receiving the life-saving interventions that they need. Wisconsin is one of 3 states that was selected to be piloted as a state-based narrative campaign through this national initiative. And we're looking for partners. So if people are interested in being part of this really innovative statewide narrative campaign, please feel free to contact us at info@dohmen.com.
Thank you, Rachel. So I'm actually going to shift to our kind of concluding question to kind of sum this up as we've very quickly run out of time, unfortunately. What would you say, and then we'll ask each panelist this question, and we're basically out of time, so we have about like 30 seconds per panelist to answer this, but what would you say the food as medicine movement is going to look like 5 years from now? And Rachel, you take the first crack at that.
Okay, so 5 years from now, I think that we're going to have a food system that promotes health, not diet-related disease. I think that you're going to see a major expansion in scaling of food as medicine within Wisconsin and across the nation, and that we will also have an expansion of really healthy, nourishing food made available to everyone, regardless of income and geography.
Thank you. Amanda, how would you answer that? What is the food as medicine going to look like 5 years from now?
It's a great question. I think one of the key points is we're going to know so much more. We'll have so much more data and we'll have tried so many things. Is my sincere hope and dream that we've got locally available foods in conveniently located grocery stores in communities across Wisconsin that are well connected to our farmers, that it is affordable and available when you need it. And I would imagine then in a system that provides access to healthy foods as the standard, then we can have folks like Medicaid and our plans and our additional partners focus on how we tailor meals and diets to a medical need. So we don't have to medicalize food broadly and instead can keep that in a tailored space. That'd be super cool.
Thank you, Amanda. Kathy, what do you think?
And so in 5 years, so envision future state 5 years from now, I see us, to Amanda's point, taking the learnings that we've had over the past 5 years, but 5 years previously, to have a fully connected ecosystem. So the points that we just discussed with regards to the need for sustainability and to remove barriers, to have been able to solve for that. I see that food as medicine lands in the exam room, right? So it's not a tertiary concept, it's not a side concept. It is one of the tools in a medical professional's toolbox to be able to support their patient, no matter socioeconomic status. And I'm going to go out there on a limb, right? Because bold is beautiful. Seeing the evolution of food as medicine starting to evolve to not just precision nutrition, but therapeutic nutrition.
Thank you. Michelle, we will give you the final word. What is food as medicine going to look like 5 years from now?
Well, I'll make it pretty brief. I'd like to see in 5 years that we will see more standardized screening, more stronger reimbursement pathways, deeper healthcare and community partnerships, and better data.
Excellent. Well, thank you all. This has been a great conversation. We really appreciate your time. Thanks to our sponsors for making this possible. We'll be back in person on June 9th in Madison for our next event with a morning breakfast event featuring DHS Secretary Designee Kirsten Johnson. Thank you all again. Have a great rest of your day.